I am Om Patel. I'm a 7th year MD PhD at the Icahn School of Medicine at Mount Sinai. Now in my 3rd year of medical school, started my clerkships in pediatrics this year. Yes, let's get started with this case, transient loss of consciousness. I appreciate that there's this nice summary of what I kind of should be expecting to see and where my brain should be going in terms of syncopal versus non-syncopal episodes. I think it helps provide a nice framework for what I should be thinking about. I definitely appreciate that there's this emergent versus must not miss delineation of things. This is a pretty nice, succinct illness script for what aortic stenosis should be, or has all the key things that I'd want to know. Seeing the classic presentation up front, I think is really nice to see, because if I just wanted a quick blurb of what this is, what I should be looking for, and then move on to what else I'm looking for, or the next possible diagnoses, I think that's perfect. And if I want to engage with it a bit more and get a full in-depth, study experience from it, I can do that. Just having an easy algorithm to access is nice to see, because otherwise I'm typing in a Google blah, 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 blah algorithm, and then have to scroll through several websites to see which is the most up-to-date one, which is accurate, which is the one that everyone refers to. So just kind of having this easily accessible is nice to see. Yeah, I like this homepage that we have here, that it's clean, easy to look at. And I like that as soon as you look straight in the middle, there's the main question that I need to be addressing. Cool, so it's also nice that I don't necessarily have to hit the back button or go back to some sort of homepage to access what we were looking at earlier. It's all kind of still right there for me. I like envisioning the tree come into fruition right here, where I started with this one major branch point. So it kind of gamifies it, and I'm very big into making this a little bit more fun, because it is a lot of content to get through, just generally speaking. And the color coordination here is very satisfying. All right, let's do this case for transient loss of consciousness.
Hi.
How are you feeling today?
I passed out suddenly earlier today.
Can you tell me more about what happened?
I was walking down the street with my husband.
Have you ever had trouble breathing before?
No.
Can you describe the pain?
It was sharp and got worse when I breathed in.
How long were you unconscious for?
I think it was very brief.
Are you taking any medications?
Yes, I take estradiol for menopause symptoms.
So I'm clicking about her physical exam. I just want to see general appearance. Okay, she seems to be generally fine. Respiratory rate of 20, so slightly elevated. Her temperature's normal, so it's probably not an infectious process. All right, so I certainly see a lot of options for physical exam. I can do, HENT, neck, chest, so lungs are clean, doesn't have any murmurs. Her JVP is high, which is a sign of cardiac failure. The fact that she had chest pain probably leads me down to the fact this might be a pulmonary embolism. Yeah, this is really helpful now to go back and forth. So let's see, positive D-dimer, relatively normal and healthy. Otherwise, she's taking estrogen and then to the CT angio. Going in, I was thinking I would probably learn what I can from the tool, then stick to the case and then just kind of brute force it. But I think it was actually far more productive for me to be flipping back and forth between the two. I actually think I learned more that way, and it probably cut down on how long I took to finish it. I think the tool is a really fun way to engage with this information. Really helpful in the fact that I have a case that I can interact with. I have all the lab tests I could ever know and need that are right there available to me and I can learn more about. But then also have these nice algorithms and pipelines to figure out what the top most important differential diagnoses are, what I can't miss. So it's everything I would need to know and would want to know for both step 1, pre-clinical years, and step 2, 3, clinical year things. I think it's all here in this tool, and I think I could use it pretty frequently.
My name is Ramon Brown. I'm a 3rd year medical student at Mount Sinai, and I'm here to try out the new clinical reasoning module. So I recently had a patient who came in with complaints of headache, so I want to go through the case mode and see if I can sort of iterate based off of that. Hi, Ms. Doyle. My name is Ramon Brown, and I'm a 3rd year medical student. What brings you in today?
I've been having a really bad headache.
What usually makes these headaches worse?
They seem worse near my period or after eating chocolate.
It seems like these are happening pretty frequently. When did they start?
About 5 years ago.
Are you taking any other medications?
Just a multivitamin daily.
Are you experiencing any visual signs, things like aura or rings in your eyes when these headaches happen?
Yes, I see bright wiggling lights before the headache starts.
So I would go to the physical tab and see if there's any just like using the light ring and just do like a basic eye exam. The three that I'm selecting are cluster, migraine, and tension for differential. All right, confidence level high, finalize and get report. This is the illness script. So just going through all of the sub fields and sort of like seeing like, hey, based off what the patient's complaining of, like what sort of things, what should I be sort of looking out for? This is a good self-check to make sure, hey, like don't miss the bread and butter stuff while you're like going guns blazing to thinking the diagnosis that you found. I like that these are drop downs. I think that's very, very helpful. Workup is great because it's like, all right, you have a patient in front of you with migraine. Here's how you actually solve that problem. So workup is a wonderful tab to have. Drop downs are great. Like the specific drop down items themselves are also helpful. Right, so I'll go through and begin the diagnostic process. We'll go with focal neurologic findings. Now I see that there's 17 different potential diagnoses up here, so we would kind of look through and see like what the risk factors are and what the associated symptoms are. Migraine is definitely the one that seems the most likely for the case that we went through. Yeah, this is pretty similar to how we do it in real life. It's very slick. Like I'm a big fan of like drop downs, so I think this is the right balance between like, here are the big subheadings, and if you want to jump into the subheading, it's easy to do so without being like overly cumbersome. I think if you're struggling with patient cases and you're getting stems consistently wrong, this is a great way to test your knowledge, as well as see like what are the buzzwords that the test writers are going to be. This is a great way to make sure that you're doing a good job of it the first time, the next time, and every time after that. A list to say like, hey, other people in your shoes would usually ask through these things, and like that's how they get down this path. Like that is extremely helpful. The things I really like about this tool are the utility. Like, so one is like very user friendly, which is always a big plus. Second, the case mode is very helpful since it kind of mimics how OSCEs run and how real life interactions run, where you can talk to a patient, but it's sort of augmented to be able to go above and say like, hey, you can get your labs immediately, you can get your imaging immediately. And so you spend a lot less time sort of like thinking and wondering like, maybe what should I do? But you have the tool right there to help guide you down this sort of path. So I think it's a great tool. If you want to crush step 2 or crush your shelves, this is definitely the tool to buy.